This question is from Laura Loon 7790, who writes, could you talk about the connection between swollen and scalloped tongue and TMJ/bruxism and how to alleviate? Well, first let's address the word swollen. I've examined a lot of mouths in my career, and I don't think I've ever seen what I would call a swollen tongue. But this is a common sign of an allergic or anaphylactic reaction, so if your tongue suddenly feels like it's swollen, then you should probably get to a hospital or urgent care facility. It's been my experience that swelling is a very common symptom that lots of people report, but very few people I examine actually have what I would call swelling. Common causes of actual swelling could be an allergic reaction, like I just said, but also an acute injury and certain medications. Now, certain vitamin deficiencies can cause alterations in the tongue, and hormonal fluctuations can also affect the tongue. And of course, there are also genetic conditions that can result in enlargement of the tongue, and the most common one that comes to mind is Down syndrome. So if you feel like your tongue is actually swollen or enlarged, then at the very least you should tell your physician about this, and he or she can try to figure out what the cause might be, and then you could decide if something actually needs to be done about it. Now, a scalloped tongue is a different story. The connection between a scalloped tongue and bruxism is a circumstantial one that we make based on the fact that when we examine patients who exhibit signs of bruxism, like wear patterns on the teeth or very powerful and active masseters and temporalis muscles, we often see this pattern of scalloping along the lateral borders of the tongue. Now, we think what happens here is that when the muscles that squeeze the teeth together are very active, this puts a lot of stress and strain on the jaw joints and the teeth and the alveolar bone. The body attempts to neutralize or counterbalance these forces to protect those structures, and it uses the tongue to do this. And if the tongue is persistently pressed outward against the teeth, eventually those outer edges of the tongue can take on the shape of the inner surfaces of the teeth, hence the scallops. Now, I've also observed that some people have a tendency to place their tongue in between the upper and lower teeth during swallowing. And again, I think this is a protective reflex that takes over when the joints are inflamed or when the teeth are sore. And remember, the tongue is made up of muscle tissue. So if you exercise it a lot, that muscle is going to get bigger like any other muscle. If you want your tongue to get smaller, practice allowing it to relax. And people have all kinds of different postural habits when it comes to the position of the tongue. There's a whole field of practice around this called myofunctional therapy. When I take pictures of my patients with their teeth a little bit apart, I could see whose tongues are up high and whose tongues are down low. Some are expanded outwards and others are narrowed. You could practice tongue posture every day when you're in front of your mirror, brushing your teeth every morning and hopefully every evening. Open up a little bit and put your tongue up on the roof of the mouth. And then try to make it sink down underneath the plane of the lower teeth. See if you can make your tongue widen out, and then see if you can make it get narrow. And then feel for yourself where the tongue feels most neutral and relaxed. Let it sit there as you take a few deep, slow, controlled breaths. I hope this helps, and thanks for the question.